Alliance and practitioner standard within the pharmaceutical sector. He is a lawyer, he is a pharmacist, and he was the former regional director of Pharmacy Council at the Northern Region. And now, here is the registrar of the Pharmacy Council. Ladies and gentlemen, please join me in welcoming our keynote speaker for today, Pharm Michael Kudabo, Esquire.
Please, Mr. Chairman, members of the Executive Committee of the Pharmacy Owners Association, distinguished pharmacy owners, esteemed industry leaders, my regulatory partners, respected stakeholders in Ghana's healthcare ecosystem, good morning. I am deeply honored by the invitation to serve as the keynote speaker at this year's annual general meeting of the Pharmacy Owners Association. Did I hear you say this is the first one? Okay, so I have to edit my statement and say that I'm honored to be invited to the first annual general meeting of the Pharmacy Owners Association. I bring you warm greetings from the Pharmacy Council of Ghana and express my profound appreciation to the Executive Committee for this opportunity to engage with you on a subject so vital to the sustainability and transformation of our profession. Let me first commend the association for its foresight in convening this important gathering under the theme, Navigating the Future of Pharmacy Business, Challenges and Innovation. This theme is not only timely, but also essential. Across the globe, as Mark said, the pharmacy business is at a crossroad. Disruptive technologies, evolving patient expectations, shifting regulatory landscapes, and the rising burden of non-communicable and chronic diseases are transforming the way pharmacy is practiced and perceived. Ghana is no exception. In the midst of all these evolving dynamics, pharmacy owners continue to serve as a fulcrum of pharmaceutical care delivery in Ghana. You are the employers, the financiers, the risk bearers, and the custodians of investment that drive the pharmacy sector forward. Indeed, in many ways, you are the unsung architects behind the public access to safe, effective, and affordable medicine. Clap for yourself, you've done so well. Let me say that since 2020, the public sector has not recruited any pharmacists. Yet, within that same period, over 1,000 pharmacists have been graduated from our institutions. Without your commitment and capacity to absorb these young professionals into your establishment, many of them will remain unemployed. You provide not only jobs, but also the practical platforms through which the nation's health policies are translated into real-life impact at the community level. It is through your facilities that the patients access professional pharmaceutical services and the vision of universal healthcare find daily expressions. Today's theme calls us to action, to reflect, to rethink, and to reimagine what the future of pharmacy business in Ghana could look like. And it challenges all of us, regulators, practitioners, entrepreneurs, and policymakers to forge a shared path forward, one that ensures the sustainability of pharmacy practice while protecting public health and promoting innovation. Distinguished ladies and gentlemen, to chart the future of pharmacy business in Ghana, we must first understand the terrain we currently operate within. The pharmaceutical landscape in Ghana has witnessed significant changes over the past decade, some encouraging, others demanding urgent reform and innovation. We have seen a remarkable expansion in the number of retail pharmacy outlets across the country. This growth reflects increasing demand for accessible pharmaceutical care and the entrepreneurial spirit of Ghanaian pharmacists and investors. Yet, with this expansion comes increasing complexity. Today's patients are more informed, more digitally engaged, and more demanding of convenience, affordability, and quality. The days when the community pharmacy was simply a place to fill prescriptions are fading. It is now expected to function as a hub of primary care, wellness advice, chronic disease monitoring, and even point-of-care diagnostics. At the same time, we are witnessing the emergence of new service delivery models, particularly online pharmacies, e-commerce driven drug distribution, and digital consultation platforms. While these innovations offer opportunities to improve access and operational efficiency, they also introduce serious regulatory and ethical challenges, especially regarding quality assurance, patient safety, data protection, and professional accountability. These developments are not on the horizon. They are here and they are reshaping the way pharmacy is practiced and experienced in Ghana. On the other hand, pharmacy owners today are contending with a growing set of pressures. The cost of doing business is rising, whether due to inflation, exchange rate volatility, utility tariffs, or regulatory compliance. We must also not overlook the burden of fulfilling licensing requirements, adhering to good pharmacy practice standards, staffing qualified personnel, and maintaining up-to-date documentations and compliance systems while delivering affordable medicines to a price-sensitive public. Ladies and gentlemen, this is a complex context within pharmacy. This is a complex context within which pharmacy owners operate, and this is where the role of the Pharmacy Council becomes critical. Established under the Health Professions Regulatory Bodies Act 2012, Act 857, the Council is mandated to secure the highest level of pharmaceutical care for Ghanaians. This includes not only regulating professionals' practice and ensuring adherence to ethical and technical standards, but also guiding the strategic development of pharmacy as a pillar of national health policy and socio-economic growth. Our role is evolving. We are no longer simply gatekeepers enforcing compliance. We must be enablers, facilitating innovation, supporting entrepreneurship, and aligning pharmacy regulations with Ghana's broader health and development agenda, including universal health coverage, pharmaceutical manufacturing, and the digitalization of healthcare delivery. As we move on, the Council is committed to modernizing its regulatory approaches, enhancing transparency and responsiveness, and working hand in hand with the private sector to ensure that Ghana's pharmacy ecosystem remains vibrant, professional, and resilient. Pharmacy owners, as we look ahead to the future of pharmacy business in Ghana, we must do so with a clear understanding of the prevailing challenges that threaten both viability of individual enterprises and the overall health of the sector. These challenges are not isolated. They are interlinked and intertwined with supply chain management, human resource issues, technological capacity, financing, and regulatory complexity. Let me now outline some of the most urgent and persistent hurdles confronting pharmacy business owners in the country. Let me at this point say that last week we were at the CPPA conference at the British Council. And then before me, Madam Jansa Lutrod has spoken. And then he had actually taken the seal out of my wind. All my prepared speech was what Madam Jansa Lutrod actually read. Sitting down here, there, listening to Mark recount the challenges that pharmacy owners go through, I asked myself, if Mark say everything today, tomorrow what will I say? So I will say that Mark has taken the seal out of my wind, but I will say it my own way. But it's not different from what Mark actually recounted. So on my first list of the challenge that pharmacy owners go through in this country is fragmented supply chain and the threat of counterfeit medicines. As a regulator, I want to look at it from that angle. See, the integrity of Ghana's pharmaceutical supply chain remains a source of serious concern. Despite existing regulatory safeguards, the system continues to be vulnerable to infiltration by counterfeit, substandard, and unregistered products. These products are often through unauthorized importers, unlicensed wholesalers, or informal distribution channels, exposing patients to dangerous outcomes and licensed pharmacy owners to a reputational and legal risk. In many cases, it is the legitimate pharmacy owner who suffers the consequences, despite having no role in the proliferation of these illicit products. Beyond the risks to public health, this situation undermines confidence in the entire regulatory system. The next challenge on my list is human resource management and professional conduct. sitting down listening to Senior Ado, he said Michael is going to say something about that. I don't know whether you dubbed my speech. You know, pharmacist school and pharmacists are the best dabbers in this. If you are not a pharmacist, forgive me, but we are the best dabbers. I don't know how you got to know that. I was going to speak about that because I haven't spoken with him. But then I'll say that perhaps one of the most difficult challenges to pharmacy owners is managing human resource capital. Pharmacy business invests heavily in recruiting and training staff, only to face high attrition rates as professionals move on, sometimes without notice, seeking better opportunities. The frustration is compounded when staff members engage in an unethical or criminal behavior. Incidents of internal theft, stocking of unregistered or unapproved medicine. I want to highlight this, stocking of unregistered or unapproved medicines. As I speak with you, I'm aware, 3 pharmacy owners are in the custody of Narcotic Control Commission for stocking unregistered opioids. According to the owners, they are unaware that those things are there. It's all part of the things that they, through their formal processes, actually imported. But the staff within the facility managed to smuggle those things into the facility and sell them side by side with what the owner sells. Narcotic Control Commission got this intelligence and raided the facility and arrested everybody there and arrested the owner. As of last week, they had been there for about 3 or 4 weeks. I don't know this week they have been released or not. So these are some of the risks that pharmacy owners we expose ourselves to when we employ people of questionable and dubious character. Ladies and gentlemen, the sustainability of pharmacy business hinges on financial integrity. Unfortunately, the Pharmacy Council continues to receive disturbing reports of pilfering, petty theft, and issuance of dark checks. Chief, issuance of dark checks, we are receiving reports by some actors within the supply chain. These practices undermine trust, destabilizes wholesalers, and pose systemic risks to the national supply of medicines. Let me state emphatically, these are not just business failings, they are national security threats. The collapse of the local pharmaceutical supply chain will endanger lives. I therefore encourage pharmacy owners to adopt a robust internal controls and to report incidents of theft, inventory fraud, and dark check issuance to the council. We are ready to collaborate with you in rooting out these unethical practices and preserving the credibility and viability of the pharmaceutical sector. Addressing this challenge requires not only internal reforms in hiring and supervision, but also systemic support in the form of a national HR verification system for pharmacy staff, professional ethics training, and a stronger emphasis on accountability at the point of service delivery. The rising cost of doing business is a critical concern across sectors, but its impact particularly pronounced in the pharmaceutical sector, where profit margins are already narrow, volatile exchange rate, a heavy dependence on imported medicines and consumables, and escalating utility bills have significantly increased operational costs. Compounding these pressures are growing tax obligations, recurring licensing renewal fees, and the expectations from some professionals for an entire year's salary upfront, even when engaged mid-year. Moreover, the push for mandatory infrastructure upgrades and the adoption of digital technologies, while essential for modern pharmacy practice and regulatory compliance, further strain the financial viability of many pharmacy businesses. This inflationary environment is pushing some smaller businesses to the brink, especially those operating in low-income or peri-urban areas where affordability is a major concern. The cost burden also limits innovation and deters expansion into underserved regions, undermining the very goal of equitable access to medicines. The pharmacy of the future is undoubtedly digital. However, the transition to a digital regulatory and operational environment is not without growing pains. While some large urban pharmacies have successfully adopted software-driven inventory management systems, point-of-sale platforms, and data-driven patient care models, many small and medium-sized pharmacies are still operating manually. The lack of access to affordable, user-friendly digital tools puts these businesses at a disadvantage. Moreover, the increasing reliance by regulators on electronic submissions, e-inspections, and real-time tracking systems, especially in opioid regulation and pharmacovigilance, means that digital lagging pharmacies risk regulatory non-compliance. Mark talked about delayed reimbursement by health insurance. Many pharmacies that offer services under the National Health Insurance Scheme face long delay in claims processing and reimbursement. This creates cash flow constraints that ripple across the business, from paying suppliers and staff to restocking essential medicines. In parallel, access to credit remains highly restricted. Commercial banks often view pharmacy business as high risk and demand collateral that many small operators cannot provide. Even when loans are approved, interest rates are prohibitive. Without affordable working capital and reliable cash inflows, pharmacies are forced to reduce service scope, limit costs, limit stock, or close entirely. Ladies and gentlemen, these challenges, if unaddressed, threaten to compromise the survival of legitimate pharmacy businesses, deepen inequalities in access to essential medicines, and erode the quality of pharmaceutical care across the country. However, I stand here today confident that these challenges are not insurmountable. They are signposts, not stop signs, on our collective journey. What is required now is a bold and collaborative agenda, one that embraces innovation, reinforces compliance, and ensures that pharmacy owners are not left to navigate these storm waters alone. Distinguished ladies and gentlemen, the challenges facing pharmacy business owners in Ghana are formidable, but adversity also brings opportunity. The Pharmacy Council, in alignment with national health priorities and global best practices, is committed to transforming these challenges into strategic levers for progress. Let me highlight some of the key innovations and regulatory shifts that are already underway or are on the horizon, and how pharmacy owners can position themselves to benefit. Transition to a technology-enabled regulatory framework. The Pharmacy Council has embraced digital transformation as a cornerstone of modern regulation. From licensing and inspection to supply chain tracking and data reporting, our regulatory processes are becoming more streamlined, transparent, and efficient through the integration of digital tools. For example, the Council's online practitioner and premises license platform are helping to reduce bureaucracy, minimize face-to-face bottlenecks, and improve accountability. The upcoming rollout of the electronic pharmaceutical inspection and monitoring systems will allow for real-time surveillance of inventory, including controlled substances, thereby enhancing traceability and regulatory compliance. For pharmacy owners, this shift means two things: increased ease in interacting with the regulator, and two, the imperative to invest in compatible pharmacy management systems. The pharmacies that will thrive are those that embrace these tools early, because compliance will be increasingly digital by default. Also, strengthening collaboration across regulatory and professional bodies. The Pharmacy Council recognizes that the complex issues affecting sectors cannot be addressed in silos. That is why we are deepening collaboration with institutions such as the Food and Drugs Authority, the Narcotics Control Commission, and Health Facilities Regulatory Agency, the Ghana College of Pharmacists, and the Pharmaceutical Society of Ghana. These collaborations are facilitating unified responses to challenges such as illegal drug markets, online sales of opioid, and the harmonization of standards in pharmaceutical education and continuing professional development. For pharmacy owners, this means clearer expectations, more coherent policy direction, and an opportunity to influence reform by actively engaging with these platforms. We encourage Pharmacy Owners Association to take advantage of this new consultative framework to voice your challenges, propose solutions, and to co-design policies that reflect the realities of the private sector. To co-design policies. Mr. Ado, about 3 months ago, You came to my office with a lot of your people, including this human being. I want to report him to everybody here. We agreed that we're going to come with something, a system that requires wholesalers, retailers to design an invoice that requires that a pharmacy must order product before they are dispensed. And before you left my office, you said that I should allow you to give us a sample of a prototype invoice so that we can incorporate it into our system. 2 weeks arrived. I called this man. He said that 2 weeks time, I'll get it. We are in the 4th month. He has not even called again. So we do not navigate into the future with this kind of behavior. Amen. Regulatory support for responsible and expansion and regulatory support for responsible expansion and innovation. The Pharmacy Council is committed to enabling the responsible growth of pharmacy businesses, especially in underserved and rural communities where access to medicines remains low. New licensing guidelines and inspection protocols are being reviewed to make room for innovative business models, especially those in the rural areas. Another strategic area of innovation is human resource regulation and capacity building. The Pharmacy Council is introducing reforms to improve ethical standards, reduce professional misconduct, and support recruitment and retention of qualified personnel. Initiatives include mandatory background verification for new hires and a national register of sanctioned practitioners. This will be accessible to employers. We are also coming out with a scheme for business owner focused CPD designed to equip pharmacy owners with tools in leadership, HR management, legal compliance, and business sustainability. You, our business owners, are not just employers. You are leaders in a pharmaceutical ecosystem. Building a positive, ethical, and competent workforce starts with you. The Council is here to support in that vision. As we look to the future of pharmacy business in Ghana, it is essential to recognize that our transformation is not occurring in isolation. Regional and continental initiatives present unprecedented opportunities that pharmacy owners must strategically harness to remain competitive and relevant. Pharmacy owners must begin to position themselves for Ghana's participation in the African Continental Free Trade Area and its intellectual property protocol, which will redefine access to regional pharmaceutical markets. Ghanaian pharmacists, especially those with ambitions for regional expansion, must prepare to meet a cross-border standard. The Ministry of Health, together with other national bodies, is working to facilitate Ghana's leadership in pharmaceutical services under AFTA. Pharmacy owners must think not just locally, but regionally. Again, as we look to the future of pharmacy in Ghana, it is clear that no single actor can carry the responsibility of transformation alone. The challenges we face and the opportunities we seek demand collaborative governance. A model where regulators, industry players, academic institutions, and professional bodies work together in mutual respect and strategic alignment. Let me take this opportunity to reaffirm the Pharmacy Council's firm commitment to this collaborative approach. At the Pharmacy Council, we are reimagining what it means to be a modern regulator, not as a distant enforcer, but as a responsive partner. We are streamlining stakeholder engagement channels to ensure your voices are heard in shaping policies, drafting guidelines, and reviewing operational challenges. But dialogue must go beyond consultation. It must lead to shared ownership of outcomes. We count on you, not only to raise concerns, but to propose workable solutions, support peer accountability, and champion best practices within the profession. No pharmacy operates in a vacuum. You are a part of a broader health system that includes regulators, funders, suppliers, clinicians, patients, and communities. As such, our governance must become more intersectoral and interconnected. As pharmacy owners, you are frontline health entrepreneurs employment generators, and guardians of therapeutic integrity. Your practices are where policies become realities, where guidelines are tested in the real world, and where the patient ultimately experiences care. That is why your engagement in governance must go beyond compliance to active participation in shaping the future. Whether it is through supporting digital innovation, investing in ethical staff development, expanding access to underserved areas, or promoting quality-assured medicines, you hold the keys to many of the outcomes we seek in our national health strategy. And that is why we also encourage you to support the Council's push for reforms in areas like prescription audits, opioid traceability, and data-informed licensing decisions. These are not just regulatory imperatives. They are business imperatives that will distinguish the ethical from the unscrupulous, the sustainable from the vulnerable. Ladies and gentlemen, the future of pharmacy in Ghana must be inclusive, innovative, and anchored in public trust. It must be one where every community, urban or rural, has access to professional pharmaceutical care, where pharmacy businesses are resilient, ethical, and digitally empowered, and where regulations serve as catalysts for quality and sustainability. To achieve this, ladies and gentlemen, we need all hands on deck. The regulator cannot work alone, neither can the business owner, the educator, or the policymaker. We must move forward as partners, bound by a shared vision and a collective duty to the people we serve. Let this AGM be more than gathering. It should be a starting point for strategic collaboration, honest introspection, and decisive action. Let us commit today to doing business in a way that protects the patient, empowers the professional, and sustains the system. Ladies and gentlemen, the COVID-19 pandemic revealed one undeniable truth. A responsive and robust local pharmaceutical sector is not merely a public health asset. It's a matter of national security. During the COVID crisis, supply chain disruptions and external dependencies laid bare our vulnerability. We must never again allow our health outcomes to depend solely on foreign supply chains. We must therefore put Ghana's future health security into our own hands. This means strengthening local manufacturing, supply resilience, and community access to essential medicines. Pharmacy owners are strongly encouraged to align their business strategies with the priority areas of Ghana's domestic health agenda, as well as emerging opportunities within the West African sub-region. Strategic alignment with national programs not only ensures commercial sustainability, but also positions pharmacies as integral actors in public health delivery. A central pillar of the current administration's health agenda is Mahama Cares, which focuses on the prevention and control of non-communicable diseases. The success of this initiative depends largely on the consistent availability of quality essential medicines across both urban and rural areas. As the frontline suppliers of these life-saving medicines, pharmacy owners play an indispensable role. Your commitment to high standard in sourcing, storage, and dispensing will directly influence the program's outcome. Furthermore, your active involvement in patient education, adherence support, and lifestyle counseling will be critical in determining the long-term success of Mahama Cares and its impact on national health indicators. Ladies and gentlemen, colleagues, I cannot conclude this address without touching briefly on the opioid epidemics. The opioid crisis in Ghana is escalating at an alarming rate. The indiscriminate distribution of unregistered and often lethal opioid products has become a national emergency. Working closely with the Narcotics Control Commission and the Food and Drugs Authority, the Pharmacy Council is taking firm regulatory action. Any pharmacy found engaging in the sale of unregistered opioids will face the following sanctions: immediate revocation of the pharmacy licenses, revocation of the superintendent pharmacist practice licenses, criminal prosecution without prejudice to any additional sanctions under the law. It must be put on record that these actions will be prompt, decisive, and non-negotiable. We expect all pharmacy owners to take active stance in helping the nation combat this threat. Your vigilance, compliance, and cooperation are indispensable. Mr. Chair, ladies and gentlemen, as I conclude, I wish to state once again that I wish to thank once again the Pharmacy Owners Association for this invitation and for the critical roles you play in Ghana's health sector. I salute your resilience in the face of economic pressures, your ingenuity in navigating evolving challenges, and your contribution and your continual partnerships with the Pharmacy Council. Let us join together boldly, ethically, and innovatively into the future of pharmacy in Ghana. Thank you, and may God bless our profession, and may God bless our homeland, Ghana.